Hello, my name is Guadalupe Castro. I am the 4-H Youth Development Agent with Cooperative Extension Program here in Cameron County. And today we are going to be talking about personal actions that we can take as a part of COVID-19. So first personal action that we can take is something that you've seen in the news that has been recommended, which is to stay at home when you are sick. Stay at home for at least 24 hours after you no longer have a fever or signs of a fever without using any fever reducing medication. If you feel that you are all better and healthy and you feel you can come off of your fever reducing medication, you still want to stay at home for another 24 hours just to make sure that you really are as healthy as you feel. You want to cover your cough and sneezes with a tissue or in your sleeve, as we have mentioned before in previous videos. You want to wash your hands often with soap and water for at least 20 seconds. Key times to wash your hands. We want to think about, well, I wash my hands every time I go to the bathroom. That should be enough. Right now we want to be diligent about washing our hands. So some of the key times to wash your hands would be after you blow your nose, cough or sneeze, after you touch common public items. If you're going to the store and you have to touch a doorknob to go into the bathroom, or you have to touch other items to purchase. We don't know who else has touched those items, so we want to make sure that we are washing your hands after all of that. Before, during, and after preparing food. Because anytime we prepare food, a lot of times it's not just for ourselves, but it's for other people. So we want to make sure we're keeping everybody safe. Before eating food, before and after caring for somebody at home who is sick with vomiting or diarrhea. Before and after treating a cut or wound. You want to also wash your hands after using the toilet, after changing diapers or cleaning up a child who has used the toilet. You also want to wash your hands after blowing your nose, coughing, or sneezing. Also thinking about your animals and pets. If you have pets at home, you want to wash your hands after touching an animal feed, or any kind of animal waste. We want to wash our hands after handling pet food or pet treats, and as well as after touching the garbage. If we're grabbing our garbage to take out to the house, out from the house, we want to wash our hands after that as well. There are some environmental actions that we can take to protect our environment. So we want to disinfect surfaces and objects that are frequently touched. A list of EPA-produced products that are expected to be effective against COVID-19. Again, this is all new, so these are the things that are expected to be effective, can be available at this website, www.epa.gov. Diluted unexpired household bleach is also effective against coronaviruses on appropriate surfaces. The ratio for your diluted bleach should be 1 to 10. So you can fill a container 90% with water and then fill the remaining 10% with bleach. Or you can mix a 1/4 cup of bleach with 2.5 cups of water, and you can put that in a spray bottle, and you can disinfect your surrounding areas where it is safe to use bleach to disinfect. Of course, you don't want to use that around dishes that you're going to eat or food that you're going to eat as well. Community actions, we've talked about some of these things, and you're starting to see more and more of these things being talked about on the news. Policies and strategies that might be recommended to prevent the spread of the disease, which would be social distancing. You've heard of this phrase quite a bit. Social distancing is creating ways to voluntarily increase distance between people in settings where people commonly come into close contact with one another. So you want to talk about, grocery stores, restaurants, parks, the beach. You're starting to see a lot of these things being closed. Work as well, So social distancing just means that we are creating more distance between, one person to another so that we can prevent the spread. As we had talked about before, spreading COVID is, the droplets are getting from one person to another. So distancing each other is the best way really to help prevent that. Closures, temporarily closing child care centers, schools, places of worship, supporting events, concert festivals, conferences, and other settings. We're seeing a lot more of that happening nowadays because, we're really trying to prevent the spread through social distancing. All right, thank you very much for joining us today, and we hope to bring you more information. Thank you.